In this video, we're looking at health and safety protection at work if you're pregnant during the COVID-19 pandemic. What can you do if you're pregnant and you're worried about catching COVID-19 at work? Well, firstly, you need to notify your employer about your pregnancy in writing, so send your employer an email. All employers have a legal duty to carry out a risk assessment, and they must specifically look at the risks during pregnancy, if you've given birth in the last 6 months, or if you're breastfeeding. Your employer must follow current government guidance on social distancing to avoid risks of infection. Current government guidance says that pregnant women, those with underlying health conditions, and anyone over 70 is more vulnerable, and you're advised to be particularly careful to exercise social distancing by continuing to work from home wherever possible and minimising contact with others outside your household. If your employer is asking you to go back to work, they must carry out a risk assessment and follow the government guidance on working safely, and this applies to a range of different sectors. You can find this working safely guidance on the gov.uk website here. What action should your employer take to remove risks at work if you're pregnant? Well, your employer must take action to remove workplace risks such as heavy lifting or standing for long periods. All workers are entitled to reasonable adjustments to your working conditions and your hours and work. If there are still risks and you're an employee, you're entitled to be offered suitable alternative work on the same terms and conditions. And suitable alternative work must be similar to the type of work that you normally do and on the same days and hours that you normally work. If the employer can't make your workplace safe and there's no suitable alternative work that you can do, then you must be suspended on full pay for as long as the risks remain. There's guidance for employers from the Health and Safety Executive, which you can find here, and it's a good idea to show your employer this guidance. Do agency workers have the same rights? Yes, you do, as long as you've been in the same placement for at least 12 weeks. And your agency must provide you with suitable alternative work or suspension on full pay if you're unable to continue in your placement for health and safety reasons. And this is for as long as your placement was due to last or would have been likely to last. So what should you do if you've been sent home on sick pay? Well, statutory sick pay is not payable unless you're ill or you're self-isolating with coronavirus symptoms or because you've been in contact with somebody with coronavirus symptoms. If your employer is unable to provide safe work or work from home, your employer must suspend you on full pay. And if you've only been paid statutory sick pay or you've been sent home on unpaid leave, you may have a claim for unauthorised deduction of wages and pregnancy discrimination. So how can you resolve it? It's important to speak to your employer to try to resolve any disputes at work. Many employers won't know about your rights during pregnancy and are working in very difficult circumstances. So it's important to get information to show your employer and get advice on your individual situation. You can find frequently asked questions on the Maternity Action website and a model letter for asking for health and safety protection. If you're not able to resolve it and you're thinking of bringing a tribunal claim, you'll need to telephone ACAS to start early conciliation. ACAS's telephone number is 0300 123 1100, and you can see it on the screen here. The time limit for taking action in an employment tribunal is 3 months less 1 day, so you must seek advice as soon as possible. And you can find more information about health and safety during pregnancy on the Maternity Action website here.